Welcome to Coming About with David Paragamian, the podcast that dives deep into the minds of leaders who have transformed their businesses and industries, paving the way for a better future. Here's Dave.
On this episode of Coming About, I'm excited to welcome Bill Veltre. Bill, thank you for being here. I'm so excited to talk a little bit about the fascinating journey that you've had in healthcare marketing, advertising, and communications. Bill is a healthcare communications leader and true industry star whose journey has taken him from, wait for this folks, a first grade classroom to some of the largest advertising holding companies in the world and to some of the largest advertisers as in the brands in the industry, and back now into the agency world. So, Bill, welcome to Coming About.
Thanks for having me, Dave. I'm excited to be here.
Now that I've set it up that your journey has been one with plenty of pivots and changes and learnings, let's start at the beginning. It all started in a first grade classroom in New Jersey. How'd you get there, and how did you know that wasn't exactly where you wanted to stay and you needed to pivot out of there?
It's a great question. First, thanks for the amazing introduction. I'm going to bring you everywhere I go. Teaching was something that I was so enamored by. I think as a youngster, I always looked at my teachers as idols, mentors, and I wanted to put myself in their shoes. I felt as if I had the gift of being able to showcase or guide, students to new knowledge. And when I went to college, I originally went as an accounting major. I was really good at numbers. I thought math was the way to go. And then I quickly switched, gears. I pivoted and knew that, my passion for being in the classroom was definitely the choice. Teaching first grade, I taught in the district I grew up in. I actually worked for the principal who was my 7th grade math teacher. It was a really rewarding experience, but teachers, are, I think, shining stars in our world, and unfortunately are not paid enough or acknowledged enough for the work that they do. In addition to that, the parameters that they're put upon are so large. Just the teaching to the curriculum and having to achieve scores on a test. It takes the fun out of dealing with kids and making them inspired to learn, empowered to learn. So I quickly learned that I wasn't going to last. We went on strike. It was weird, the politics. And I said, what else can I do? So I started to think about being a sales rep. So I actually sold curriculum for a while. I pivoted into marketing from a publisher perspective. Print was dying. I didn't really have the vision with some of the publishers I was with to see, into the future. And I had a mentor who was doing really amazing things from a healthcare marketing perspective. And talking to them, I realized that there was an opportunity to potentially use some of the skills that I had acquired from teaching as well as sales to pivot into the sciences and health science industry. And I quickly, attained a position at a leading agency.
That's a great story. And you've actually touched a number of different things that I'd love to talk a little bit about on this session. One of which was the power of a mentor that helped shape you. I'm also wondering, knowing what a good marketer you are and how insightful you are about patient insights, was there a patient experience or a family experience that sort of said to you, healthcare is the right answer?
Of course. I don't want to get emotional. I knew I was going to.
There's a why behind it, which is why.
Yeah, and this better than anyone. I read your book, and I'm so appreciative as a resource, and just such amazing vulnerability that you showed. I watched both of my parents pass away to cancer, and watching them take their last breath was a motivating factor for me, that I didn't want any other patient to have to reach that point in their life when there are available treatments and options available for them to live with their condition or maybe even cure their condition. That's the power being a care partner and, a marketer. And I base everything that I do on those final few seconds.
While you digest that, I will just say thank you for sharing that. And I will tell you, I often tell people, I tell the people I work with at my company, healthcare communications is healthcare. The real hero in the story, of course, is the clinician in the white coat and the woman or man bravely facing the disease state as they navigate together what's next for them. But the fact that as healthcare communicators, and I don't even want to use the word marketers or advertisers, but as healthcare communicators, in some small way, we're helping facilitate that conversation, enable that conversation, provide data or materials for that conversation. We're in the room. We're in the room that matters at the moment that matters, and we're helping those people. And that's a great why. And although there are some first graders in central New Jersey that are missing out on one great teacher, the healthcare communications industry is better for it that you're with us. So thank you. Well, let me do this. Let me take you to the next sort of the chapter, as you said. So you went into the agency part of the world first before you went and worked for some of these big marketers. But then you've also worked for AbbVie, Bristol Myers Squibb, a predecessor company that's now part of AbbVie. What would you say are some of the cultural differences? You observed those differences in the classroom of what you thought it was going to be like. What are the cultural differences between big agency, holding company, big pharma advertiser?
I would say that the cultural differences really are very much more similar than we think, than disparate. And, there's pressure. Pressure is different on the agency side than it is on the client side. But ultimately, the goal is the same, helping more patients. I think that a lot of agencies talk about being patient-centric, but feeling patient centricity is really seeing it in the results. On the client side, watching those numbers grow from a forecast perspective and seeing how many people you're actually impacting is truly life-changing. I mean, the opportunity of being able to be a part of that pressure is something that I think is a very big cultural difference. I think the agency feels it on the periphery, but being in the room and talking about the highs and lows, your access curves, your inability to crack, certain accounts and, teaming up with your sales colleagues and understanding how to pivot and ultimately drive better impact within that category is such a unique experience. The pressure is immense, though. I mean, the brand marketer is the hardest job in our industry, hands down. They have the highest amount of pressure on their shoulders, and they're trying to wear a lot of different hats. And that's the next part that I wanted to tell you was you have to be a multifaceted thinker. And sometimes on the agency side, you can fall into a silo, and you can get comfortable there and maybe even complacent. But as a client and, being a marketer, you have to wear a lot of hats. And sometimes your teams aren't really big and you don't have any additional FTEs and you have to take on tasks. So you may be the VP of marketing, but you may be working on a brief. And that is just part of the game of, making sure that you can do every bit of work that needs to be done in order to get the product into market. Commercialization is a very complex part of our business. And I have such a great appreciation for the people who are specialized in it because it's a team effort, but it's all hands on deck. Everybody does whatever it takes in order to make the business function. And then the last cultural difference is, on the agency side, sometimes I think we fall short on understanding the importance of the sales. And I don't think that it's just sales from a personal perspective. I think it's an MPP perspective, but really the way that patients and physicians connect is a very sacred ground, and our ability to influence them is something that I love talking about because I can't make them right and I can't make them ask, but I can do my best to influence them. And that's all sales techniques. The sales rep in our industry is, another really sacred piece that needs to be, thought about differently. And, as the world changes and we evolve, that human touch and that human connection is still really well needed. And then on the MPP side, it's how do we complement everything we could do in person and make it feel like it's personable. I'm just so enamored by the sales vehicles that we have at our fingertips and our ability to influence those conversations, again, to impact more patients.
Bill, one of the things you said was about the breadth of what is asked of a pharma brand manager. And I often say, brand management is such a great training ground for general management for exactly that reason, that you're touching on so many aspects of the business. Yes, advertising, promotion, but product development, clinical work, med affairs, production, all of those things that go into a brand person's day. And I think as I've sat on both sides of the desk, the one thing that I always tried to caution people on the agency side was, folks would say, well, I haven't heard back from the brand manager. Why hasn't she called? It's been 2 hours and I really want to talk about this issue with the 60-second spot. And I'd have to say, well, wait a minute. She's got more on her plate today than just that 60-second spot, right? There's so many things. And of course, as you're right, in the agency world, we sometimes become specialists. And I sometimes think the best agency person is the one that, as you just said, thinks about the client's business in a more holistic way, so that it is about the business, it is about reaching those patients and what makes this product different. I know that you have gone from agency to client and now back to agency again. What do you think makes a great client? I hope you have a bunch right now, but what makes a great client, Bill?
So we definitely do at Deerfield. I'm very fortunate to be able to work with an agency that does have an amazing client roster. But I think what makes a great client is the ability to be transparent. Your goals have to be your agency's goals. And everyone has to be able to see that North Star together. And if you're withholding information, it makes it harder for those that are your agency partners to do their job and ultimately help you achieve what you want to achieve. So it's collaborative goal setting and being extremely transparent with that information so that that happens. The second is trust. I mean, it is hard for a brand manager to do all of the things that we were talking about, right? They wear so many hats. Have trust that you've hired an expert. There's people who are experts in their field and they are siloed for a reason and they're really good at being siloed. So let them shine. I really have worked with some amazing agencies in my career. And I think the ones that have always prospered or have been the ones that I've allowed them to do what they're really good at and not interfere, not give them directives, but give them guidance and support in order for them to ideate and ultimately bring the ball across the finish line for me. And then the last is partnership. I am a firm believer that in our industry, we have, a problem. And that problem is that we think too transactionally. And a lot of the vocabulary we use around the people we partner with is we use them as vendors. It is a word that makes my skin crawl because do you know what? A vendor is someone you purchase a service from and then you don't care about them and you walk away. Our business is built on empathy. And if we want to get to further, we have to do it together. And the only way we're going to be able to do that is if we truly partner as one team. And that means clients, agencies, and media partners. And that triad is such a powerful combination. We have so many smart people in this industry, all filled with hearts. And everybody has the same latent need, which is to help patients. It's a very caring industry. And why not build on that and make sure that partnerships are strong? Let's remove the word vendor from our vocabulary and let's build partnership.
I love all three of those points, the transparency, the trust, and partnership. And I'll go where you just were, which is I sometimes think partnership is such an overused word that we've lost the real benefit of it, because you're talking about partnership with a true capital P, where people have a seat at the table. We listen to one another. Ultimately, of course, the decision belongs to the client. It's his or her money, totally get it. But the idea that there is this exchange of ideas and a willingness to listen, I think it's something that you have to constantly work at. And it's not by definition a priority for everyone. People show up, they think they know how to do that. But it's a little bit like being a good spouse, right? We have to work at it day by day to make sure that we're listening, we're bringing everybody's strengths to the table. I've certainly seen it the other way, where there's transactional relationships, and you can predict what the ending is in a business is when it becomes a transactional relationship, and the average tenure of those relationships is going to be short. I love this concept of partnership with a capital P. And speaking of a P, we're going to have to pause there. But next time on Coming About, Bill Veltre, the Executive Vice President and Head of Media at Deerfield, will talk about the impact of artificial intelligence on healthcare marketing industry today.
I do think that AI will have a great impact on our ability to do our jobs. And what I mean by that is I don't think that AI is going to limit the number of people. I think what it's going to do is it's going to help us grow our capabilities to a level that we haven't seen before.
This has been Coming About. We hope these conversations have left you feeling empowered and ready to take your organization to the next level. To speak with Dave about your business transformation or to learn more about Health Monitor Network, go to healthmonitornetwork.com. And don't forget to check out his book, Coming About: How We Transformed a Major Media Company and the Lessons There for You. Available wherever books are sold. Coming About with David Paragamian is a production of Advantage Audio.